Now, good afternoon. This is Dr. Romero Salinas at Lincoln University in Missouri, and we are so uh, happy to introduce today Dr. Jamie Stewart with the topic 4. She will be talking about the management, taking care of the dog. And so as you know, Dr. Stewart has been talking with us about different subjects, and here also is Dr. Acharya that is working here at Lincoln University, and Jennifer Lutz that accompany us from Missouri University. So you want to just welcome the people, Dr. Stewart, and start, please.
Okay. Mm, Okay. All right. Well, thank you again for the introduction, and it's nice to be back here. So for those of you who've been joining us every week, I talked a couple weeks ago, touching on the reproductive anatomy and the physiology of the estrous cycle. And so this is meant to be a sequela to that of how do we utilize that information to help with our management of our female small ruminants. And I'll have a whole separate talk to cover the males. So for this session, we should be able to understand, we're going to start with a little of nutrition and along with that is going to be husbandry, how that's going to be used to alter reproductive success in both does and ewes, and then describe the appropriate techniques for estrous synchronization. So talking about hormonal and non-hormonal techniques. And between the first and second talks that I gave, there were a lot of questions about different parts. So hopefully some of those will be answered as I go into a little bit more in depth. And the last part is at the end of all this, hopefully you should be able to identify your best breeding strategy based on what your goals are. So based on different techniques, synchronization, and what you're trying to accomplish at the end of it all. So to begin, I always want to make sure that I discuss not only reproduction, but herd health because a happy animal is a productive animal. So so we want to make sure that we're considering all things biosecurity. So working with your veterinarian to determine your vaccination protocols that are needed. And if you're bringing new animals in, what kind of testing is needed. And if you're bringing new animals in, or if you are doing a lot of showing, identifying what kind of quarantine protocols you would want for those animals to minimize the risk of you bringing any diseases into your herd that might be of concern. And then always making sure that we have an effective deworming protocol. And so that usually involves, we don't do blanket deworming anymore because of resistance. So hopefully most of the people in this group know about using your FOMACHA scoring and deworming based off of the FOMACHA score. And then equally important is talking about our hoof health monitoring because animals also need to be able to walk. So to be able to breed, they have to be able to get around. They have to be healthy enough to get to the feed bunk, and the males have to be able to get to the females when they're in heat. And then along that same line, going along with husbandry is our nutrition. So making sure that we're monitoring our body condition score. And this means more than just looking at them, because anybody that has very hairy goats or hairy or woolly sheep know that their body condition can be masked, especially in the winter and especially with sheep when the wool is really, really thick. It's really easy to mask a low body condition score. So you want to make sure that you're monitoring that as often as you can with hands-on, making sure that they're getting all of their trace minerals, that hay quality is good, and then based on where they're at in the life cycle, grain supplementation is needed in different ways, and then also pasture management, which goes back to our deworming program, and if we're doing any kind of pasture rotation, things like that, that we need to be concerned about, and making sure that if that's the majority of their nutrition, that we're managing it appropriately so that they're getting enough hay and grass. So when we look at body condition scores, so the big thing that most people know is kind of going off of back here in the hip area and looking at the musculature. So feeling, so we're talking about kind of back in this area. So if you're looking at it from behind, you feel the spinal process up there. And then you've got these vertebral transverse processes of the vertebra down here, and you're kind of feeling what this fat cover is here. And I've got a picture showing what all that means. So when they're emaciated, you feel there's no fat coverage, so you feel a really big dip in there. Whereas when you get to thin versus average versus fat, this will kind of become more rounded in appearance rather than kind of a flat from the tip to the tip. And then obviously once you get to where they're completely over conditioned, it actually kind of goes the opposite way and it bulges out a little bit. So and I will send out these slides for in case anybody's asking already. But I put some links on here of where I've got some of these. So these are some of the body condition score charts that I've really liked using and felt were really useful. And so I mentioned we need to we need to keep them in a body condition depending on where they're at in the production cycle. So when they're open and we're getting ready to breed them, especially when they're not lactating and we're just trying to prepare them for breeding, we usually, and this is out of a 5, we want them at a 2 out of 5. And that might seem a little bit low, but the reason is we don't want them at a 1 because that's emaciated, but we want them quite at this marginal 1 because then if we're going to do something like flushing to prep them for pregnancy, it's going to work a lot better. And I'll have a whole slide that talks about this nutritional, and I'm talking about nutritional flushing, not embryo flushing, but nutritional flushing, where we are basically trying to push their body to produce more oocytes. So to have that work the best, we really need them at quite a marginal condition. So not a 1, but right there. And I always tell students somewhere between a 2 and 3. So if we were going to do halves, I'd probably say 2.5 would be ideal. But we want to make sure they're not getting into that 3 to 4. Once they get into gestation, we're going to be trying to, after they've gotten pregnant, we want to try to bulk them up a little bit to prepare them for lambing. And that's where we're going to try to aim for a 3 out of 5. And then again, at lambing or lactation, you want them right around that 3, and it's okay if they're a little bit heavier. But we definitely don't want them in that 4 to 5 range because then they're over conditioned. And at any time here, but mostly during this gestation period, we worry about things like pregnancy toxemia. When they're over conditioned, it increases their risk of getting pregnancy toxemia or pregnancy ketosis. You might have heard a few different terms for that in that third gestation where they get ketones and they start getting really sick. Okay, so just kind of moving on from that, and the first part of talking about how we manipulate the estrus cycle is going to be focused on that adapted nutrition or that nutritional flushing that I just talked about. But then after I've talked about that, I'm going to move on to some other things that will actually affect the estrus cycle that we can utilize. So the male or dormitory effect are 2 different non-hormonal methods we can use. Photoperiod manipulation, I briefly have touched on that in previous lectures, and we'll go into a little bit more details. And then we'll talk about hormone administration and how we can kind of use a combination of all of these to really accomplish our goals. And what our goals are is that so some people might want to try to breed them year round to allow for distribution of milk and meat throughout the year. And if that's what your goal is by manipulating the estrus cycle to breed them out of season, we talked about in the last class, and you should have those slides now, that breed selection is important. So selecting an animal that will breed well out of season rather than a breed that has a really strong seasonality component. The other part of this, and that kind of goes along with that milk and meat production throughout the year, is inducing estrus either in transition periods or during that winter anestrus. And that kind of goes back to why we would, what we're going to do to allow for having some meat production out of year. And if we talk about having lambs in the fall period when they're not really being born, you might see some premium on prices just because the supply is going to be a little bit lower. So you might even get better prices by being able to sell them out of the normal season. And then obviously synchronization for breeding is going to be a big goal of this. And part of that's going to be labor saving if we're doing any kind of artificial insemination, and we want to synchronize them all so that they can be bred at the same time, especially if we're doing it laparoscopically and you're paying for somebody to come do it. We want them all in heat at the same time. But the other part of that is if you want them all to kid within a few days of each other because you're going to hire people to come help you watch overnight, or you're going to take off work to watch them overnight, then you can make sure that you set it up so that you know when they're going to be giving birth because they all bred around the same time. So here's that piece that I was going to talk about with, I always call it adapted nutrition just because I find flushing confusing in reproduction world. So I always call it adapted nutrition. But if you hear people talk about that flushing females before breeding, that's what this means. And basically, and again, why we want to start them off at a marginal body condition is because you're giving them kind of a rush of energy right at the beginning of that early breeding season. And basically, if you have a female that's in a marginal body condition and all of a sudden you give her all of this extra energy, the body is trying to figure out, what do I want to do with this extra energy? Oh, I'm going to go ahead and maybe do, I don't, I'm okay. Like all my body parts are regulating fine. So I'm going to ovulate a little bit extra. So in the simplest term, that's what that does. If the body's already in this mode where I'm over conditioned and all this extra energy I'm getting, I'm just putting it towards fat, it's probably going to keep doing that because that's what it's primed to do. So again, in the simplest of terms, that's the reason why we want them at that marginal body condition. So, and the hope is that by starting this, and you'll see down here, it says start 2 weeks pre-breeding, and you're going to continue about 2 to 3 weeks into the breeding season. And, 2 to 3 weeks before breeding is we're really trying to help increase that ovulation rate. So we want them to double ovulate so that we can at least get twins, and improve the likelihood that we're going to have at least two babies. And again, this is going to be affected by, I already mentioned the body condition part of it, but it can also be affected by age and time of year. When they're in season, they're going to respond much better to this type of flushing. So if you're going to attempt this, at least once a year, it would be to the ones that you're breeding in season rather than utilizing the resources at a season where they might not respond as well. And this is just, you'll find a few different protocols out here, but this is one out that I believe I found from the sheep and goat reproduction book that is zero point 0.4 or 1.4 kgs to 0.45 kgs of a 10 to 12% crude protein grain per head per day. And like I said, you can find a few different protocols out there and you can adjust it each year depending on what kind of a response you see. You can always tweak it a little bit if you need to. Okay, and then I think I should have a poll question.
Okay,
For-
great.
Make sure everybody's awake.
Yeah, and now will be only three questions, so don't wait for the fourth. Okay, let's go with the first. We have like 60% of the people that answered already, so we'll be ending soon. Some people like to read very well.
This one, yeah, this one has a lot of words in it, so
Yeah, so we're going to give a little bit more time. So for the people that want to analyze well. So yeah, we we want for accessibility for everybody. So and I think we'll be ending the poll now and share the results. You want to comment?
yeah, so the good news is everybody is technically correct, because both A and B were the correct answers. There were some people that clicked only A and some people that only clicked B. So while I just spent a good portion of the time talking about that nutritional flushing, I did mention during the body condition score about the risk of developing pregnancy toxemia when they're over conditioned. So that's definitely a reason to keep them at that a little bit under conditioned also. So technically A and B were both correct answers.
Okay, good. Thank you.
Okay. All right. So moving on to other ways that we can alter the estrus cycle. So one of them is the male effect, or if you do sheep, then it's called the ram effect. If you have goats, it's called the buck effect. So I just, was all inclusive to the male effect here. So basically, what you do is you have a group of females, and this works best, and it says does, it's ewes and does. It works best if they're in that transitional period, so that period between when they're in the summer, over the summer when they're still in anestrus and we're getting ready to start the breeding season. We call that the transitional period. And that's really when this works best, is if you introduce this male suddenly to the females, and basically the pheromones that are being produced from this new male being introduced are enough that they're going to activate luteinizing hormone secretion. And if anybody remembers from the previous lecture that I give, luteinizing hormone is what induces ovulation. So once that gets activated, it's going to induce, and it's what we call the first one is what we call a silent ovulation. And I'll talk about that a little bit more on the next slide because I have a few more details. And you can do this with either an intact male, but a lot of people will use an epididectomized or vasectomized male. So just meaning that they still have testicles, but they can't breed the female because their reproductive system has been altered so that they're not able to breed. So the semen isn't going to be able to get into the females. The other option that you'll see listed out there is androgenized females, and that means that you give a shot of testosterone to some females and get them to produce these pheromones. And I just wanted to make a note here in case you read that, doing that is not legal in the United States. So giving testosterone to any food producing animals for this purpose is not legal. So that's not something that I would recommend doing. So, but having a teaser is, and you would want about one teaser per 40 to 50 females. And I would say that this is more commonly used in sheep and goats, but certainly works for both of them. And so this is the actual procedure. So basically it doesn't have to be a completely brand new male, but they have to have not been around him for at least 30 days. And when I say not around him, no sight, smell, or sound. So like we don't even want them to be able to hear him. So he needs to be as far away as humanly possible, or I guess reasonable, for your farm. So if he's just like a couple pastures over, that might not be sufficient. And so what you do is you introduce the male abruptly, and so here's where we don't have the male, and then you're going to introduce him for about 48 hours. So you've got about 2 days where he's going to be in there with the females. And this is where I talked about it causes the silent heat. And that just means that they're not going to show any signs of estrus. So you probably won't realize that they actually had a heat because they're not going to show any signs. And that's just has to do with the physiology and them not having estrogen receptors quite yet. But it's an important part for them to have the silent heat because they're going to then produce that corpus luteum. Again, another structure that I talked about in that first lecture I gave, or I guess first and a half lecture I gave, where I talked about the corpus luteum that produces progesterone. And so in this time period here, they're gonna ovulate. They won't show any signs of heat, but they're gonna have progesterone, and that progesterone is really important for getting the reproductive cycle ready for the next breeding season. They have to have that progesterone present. And then when that corpus luteum goes away, so that's what we call luteolysis or lysis of the corpus luteum. So when that goes away, then they're gonna start having an actual active heat that you can see that they're going to show signs with, and that will be a fertile heat. So the silent one's not fertile. So, and that can happen anywhere between 6 to 7 days after the introduction. So, and that's if they don't form a really good CL. So some of them can come into a good heat at about 6 to 7 days. If they do form a decent CL there, then it might still take the whole reproductive estrus cycle. So it's somewhere between 18 to 25 days for that to occur. And then, like I said, you should be able to see sexual behavior with that, and then they should be good for breeding. The dormitory effect is where you introduce a female that's in estrus and to a group of females. Again, this is hopefully going to be transitional females. And basically what happens is you introduce this one female, and about 25% of the other females will start to pick up the pheromones that she's producing, and then they will come into estrus, and then within a few weeks you'll have the remaining 75 to 80% that will respond within the few weeks. And It's a good way to help advance that breeding season without having to utilize a male. So if you don't have a teaser around, or you don't have to synchronize all of them, you can synchronize one of them. So save the expense of all the drugs to use to synchronize them. So synchronize one of them to get them to come into heat, and this will be kind of, you'll synchronize them in the way that I talk about with the hormonal synchronization. So you can do that to one female and then hopefully get the rest of them to come in to heat a little bit earlier. And you can kind of do it in conjunction a little bit with the male effect too, if you're trying to, again, look for a little bit quicker of a response. Okay, and so this is for, we talked a little bit about the photoperiod manipulation. So people had talked about, if they have the lights on at a certain time, will it affect the cycle? And I did mention that it kind of depends on the brightness of the light. So I've got some of those specs here, I think, on the next slide. So, but when we're talking about doing an artificial lighting program, so this means that you have to have confinement housing because you're controlling all of their access to lighting. And what we're going to do is the beginning of it, they have to have 8 to 12 weeks of long day exposure, meaning that they have 16 hours of light per day. Because if you're starting with a short day exposure and you're trying to extend it, eventually they'll become photorefractory and just go out of season. So you always want to start with long day exposure to make sure you're maximizing how well they respond. And then you follow it up with short day exposure, and then after about 6 to 8 weeks, then they should start to cycle. So this isn't just something that we're going to start it and be able to breed them in a couple weeks. Like, we need to plan for this ahead of time. And the nice thing about it is if you have a space in the confinement housing to put a male, then you can also put him in there and it can help to improve his fertility too. So when I talk about some of this, so I was doing a little bit of research today to see what the actual specs are for some of this. So it's been recommended about 200 lux if you're at eye level. And so you would, and with the research that I found, and actually there was a nice article I found, I put a link for it here, that it at this 200 lux, and it was actually somewhere between 100 and 200, will actually help to stimulate activity with the animals without causing extra stress. It sounds like if you get much brighter than that, then there is actually some concerns about them being stressed from the level of light. So, and then if you're a little bit lower than that, it's good for kind of just general activity and welfare, but it's not quite as good for making sure that they're getting the levels that they need for synchronization purposes. So that's where this 200 came from. And if you're looking for the actual color temperature and neutral white, mimics sunlight the best. And if it's something where you need to be able to get into the barn to be able to do work at a time where you've decreased the lights in there, you can use red lights, low intensity red lights, to be able to complete tasks without completely messing them up. So that's what's recommended for if you need to do stuff and you don't want to mess up with the light cycles that you're setting up. And then in very small letters, I put the link for the one source that I know of melatonin implants. That, again, they're not FDA approved, so you don't need a veterinarian prescription, but you kind of have to use at your own risk. But I've seen a lot of people that have used these and seem to don't have any ill effects. They're actually marketed for show animals to improve their fur quality, and but they are the same melatonin implants if you look at all the work from Australia and New Zealand where things like this are approved for use. This is the same type of product that they use, are melatonin implants. And these are stuff that you can use if you're trying to induce cyclicity out of season. It's good to use. I wouldn't use it by itself, but you can use it with a hormonal program to improve cyclicity and get them pregnant. So get the anestrus animal pregnant, and supposedly works well. I haven't had any experience with it to improve fertility in the males outside of season 2. Okay, so moving on, so kind of as the segue there is, I'm going to move on to the hormonal manipulation, and just kind of putting my disclaimer here. So the Animal Medicinal Drug Use Clarification Act or AMDUCA, as we always call it, places limits on extra label drug use in food producing animals in the US and restricts it to animals that are not, or extra label use to animals that are suffering or in danger of death. So under AMDUCA, pharmaceuticals cannot be used extra labeled to alter reproduction or for production purposes. However, we do have the Medicinal Uses in Minor Species Act that allows certain drugs and allows pharmaceutical companies to acquire conditional approval for use in minor species, such as goats. So while we have things like intravaginal drug releasing device or CEDARs that are labeled for sheep, most of this stuff are being considered as conditional approval under that MUMS Act. Um, but you do have to have a veterinary client patient relationship to acquire them. So the big thing of this is that technically we're not supposed to be using any of these hormones. So most of the hormones that we use do not have a sheep and goat label. So the cedars have a sheep label and that's about it. So the rest of them extra label falls into this really big gray area of the MUMS Act that most people are going to look the other way, but you do have to work with the veterinarian to acquire these products to be able to use them extra label. And so that's kind of going to be my little soapbox on that. So getting them just from your farmer friend next door is probably not the best way to go about it if you are want to make sure you're doing everything appropriately. So work with your veterinarian. Okay, so the first way that we can alter our estrus is by just giving prostaglandins. So you might know this as Lutalice or Estromate. These are the most common ones in the US that we have. And it's nice because you just give it one shot and it will induce estrus in about 24 to 72 hours in a cycling female. So this means that a female that is in season. If you try to give it to a female outside of the breeding season, it's not going to work because the way it works is it induces luteolysis. So it induces that corpus luteum that's producing progesterone to go away, and that's going to bring her into heat. So if she's out of season, she hasn't been ovulating, so she doesn't have a corpus luteum. So that's why it doesn't work out of season. So there's a couple different methods. So if you just go through and you blanket inject every female in your herd, you should have about 2/3 of them come into heat right away. If that's not enough, if you don't want 60% of your females to be bred all at the same time, then you can wait and you can give a second dose about 11 to 14 days later, and that should help bring that number up to about 90% of females. And the most useful application for this is under live cover. And I talked about one of the uses for that is labor saving. So again, if we want all of our females to give birth in the same like 5-day window, then doing this single or double dose of Lutalice is really good for that because he needs to be able to detect heat and he can detect heat himself, the male, and he can breed them. And then you've got a nice like 5-day window that you should expect most of them to have come into estrus and breed, especially if you do this 2-dose protocol. And you only have to give them a couple of doses and it's pretty cheap. So that's where it works well. If you're doing your own AI, so especially with like goats, if you're doing transcervical AI, you can do this, but you also have to you have to do heat detection. And I think on in one of the next slide, I think I actually have this slide on here twice, so I apologize. So I'll go through it. But I think and always wear gloves when you're handling this. So because especially, and if you're a female, try not, that's pregnant, please do not handle it. Find somebody else to give drugs. So I will just get on my other little soapboxes. Both the times that I was pregnant, I'm a reproductive vet and I could always find somebody else to give Lutalice for me. So it can cause abortions if it's even absorbed through your skin. So strongly recommend finding somebody else to give any Lutalice injections if you're pregnant. If you're not pregnant, and you get it absorbed some way, shape, or form, it'll just cause some cramping. But we want to avoid that. So I always wear gloves when handling. And then if you're a pregnant female, don't handle at all. Okay. Oh, I guess I didn't have it on there twice. Okay. So I just wanted to so I was talking about the heat detection. So if you're doing a double prostaglandin and then you're going to AI them, you want to make sure you're doing heat detection, and that's where we do the AM PM rule. So that means if they're in heat in the morning, then you're going to breed them in the evening. If they're in heat in the evening, you're going to breed them in the morning. So you're waiting approximately 12 hours or so after you first see them in heat to do the AI. And the reason why this doesn't work for if you're having somebody come out to do breeding is because As I said on this last one, estrus is going to be anywhere between 24 to 72 hours in cycling females. Some people, females, it might even be a little bit longer. So you don't have a really good fixed time for when to do the AI. And this is because in that first talk that I did about the physiology is that they've got these constant follicular waves that are going on. So we've done nothing to control those follicular waves. So if say we have a follicular wave that's occurring right here and we give prostaglandin right as that follicle is getting ready to achieve dominance. So then that progesterone is going to go away after we give that prostaglandin, and she's going to select that follicle, and then it'll go on and she'll have estrus in about 2 to 3 days, which is what we would want. However, if for some reason when you give prostaglandin, if this follicular wave has already started to undergo atresia, now you have to wait for this next follicular wave to occur, and then it's going to take longer to achieve dominance. So if you get it right here, or sorry, right here when you give prostaglandin, then estrus is going to take longer to get there. So we're talking like 4 to 6 days before that they would come into heat. Again, because we've done nothing to control this follicular wave. And that's why in a lot of the other protocols, we give drugs that affect their ability, the follicle's ability to ovulate, which I'll talk about going through. All right, so synthetic progesterone or progestins. Again, a lot of the old literature, you'll see things about sponges or literature that's from other countries. So that's kind of what these things are over here. You'll see them as either medroxyprogesterone acetate or fluorogesterone acetate, but we don't have these in the US. We actually have cedars. So most of what you'll see that's available in the US are cedars, and they work really well. So it's just a controlled internal drug release device. And basically it looks like a little IUD. It's got a little T shape on it. You put it in this little applicator, you put it into the vagina, and then you just let it sit there. And then when you're ready for it to go away, there's a little tag on it that you just pull the tag out, and then the source of progesterone goes away. The other thing that I've come across with a lot of producers is MGA or melangestrol acetate that you can top dress in the feed. So there is a dose out there that you can find that you can give to them. This is again not labeled for sheep or goats, whereas the cedars are. So per Amduca, cedars are going to be your best bet, but also cedars work better because you know that they're getting the source of progesterone at the levels that you want. Whereas with MGA, you're relying on the fact that they're going to eat whatever you're giving. And if for some reason they don't eat quite as much, you're putting them at risk for getting cystic ovaries or cystic follicles on the ovaries. So there can be some bad things to come if they don't eat all of that top dress. So I'm not a fan of the MGA, not only because it's not the more legal product to use, but also because I think the cedars work well enough, and it's just the better option. And the length of time that you're going to have them exposed to this progesterone, it's going to range from about 5 to 14 days, depending on what protocols that you see out there. So if you have somebody that's coming to do AI, a lot of them will have their own protocol that they like you to use. But if you even just look up on the internet, you'll see that there's a lot of protocols out there. And depending on what protocol you use, estrus will occur somewhere between 24 to 96 hours after removing that source of progesterone. And again, always wear gloves when handling this as a hormone. It probably won't do anything terrible to you. And this is one that I did handle when I was pregnant with gloves. So, not super concerned about it, but just always make sure you wear gloves when you're handling hormone products. And then this is just showing, this is from the insert that you can look up online, or I'll obviously share this. This is just showing when we do insert it, we always want to make sure we're angling up because the opening to the urethra that goes to the bladder sits on the floor down here. So we always angle up so that we don't accidentally insert into that urethra. And then it's pretty easy to do. So ovulation induction drugs. So there's one product that's most common in the sheep and goat world, with which you'll probably know it as PMSG, which is called pregnant mare serum gonadotropin. The other thing that it's called is equine chorionic gonadotropin or ECG. So these are the same things. We just, as a, in the animal, in the horse, we call it ECG. And in the, as the product, we call it PMSG. And so this is a hormone that will act directly on the ovary to trigger ovulation. And in the US, we don't have a straight PMSG product available anymore. There used to be. You can get it from Canada or New Zealand or Mexico. A lot of people bring it here legally to use, which, each their own. But we do have PG 600, which is a pig product, and it has both that ECG or that PMSG, but it also has human chorionic gonadotropin. So this is the hormone that's part of the pregnancy test for humans, that when you pee on a stick, that's what it's testing for. Um, and so the ECG or PMSG actually acts like that follicle stimulating hormone that I talked about earlier. Whereas the HCG has luteinizing hormone-like activity, which promotes ovulation. So the reason why most people like to use this PG 600 or this PMSG is because it will help to select multiple follicles for ovulation. So it promotes twinning. Um, Especially if you use it in low enough doses. If you use it in more doses, then you might see issues with triplets and quads that you might not intend, especially if it's a very high fecundity animal. So, but it does have a long half-life and it has that FSH-like activity, which is why most people really like it to kind of promote that ovulation. It is difficult to come by. I feel like it's always on back order because I think a lot of the sheep and goat world are always trying to buy it, but it's labeled for use for bringing gilts into heat. So there is an actual labeled use for it in the swine world. What I've been switching to more recently is just using GnRH agonists like what we use in our bovine counterparts. And so this is a product that whereas that PMSG acts directly on the ovary, this one actually acts on that anterior pituitary, and it's going to stimulate directly that LH and FSH activity that helps to promote ovulation. It has a shorter half-life, and it doesn't really promote any super ovulation like the PMSG or PG 600 does. So you don't get any of that added benefit of it. And with that short half-life, I also think that it doesn't work quite as efficiently as it does in cows or as the PMSG and PG 600 does in the small ruminants. So one of the things I've looked at is using like a long-acting deslorelin product, and it did have a little bit of promise. And the product that I actually did a study on it, and it had some promise to act similarly to the PMSG, but the product I was using was a horse product, and they pulled it off the market recently. So maybe more to come on that in the future, but the products that we had available are not available anymore. But I've been focusing more on these cisterellin or Factorel are the two products that you'll see for those. Okay, so now I'm going to go into a little bit of combining some of these. So I know most people probably have some questions about these, so this is kind of bringing it all together. So if you're within the breeding season, as far as manipulating your estrous cycle, you can do just that prostaglandin source, or you can do, especially if you're doing live cover, or you can do a progesterone source for 14 days, plus or minus doing a gonadotropin. And I've got some more the protocols that I've liked using so far. I'll have some specific protocols in the next few slides. The transitional season, again, that buck effect works really well then, plus or minus that dormitory effect. But then it also works if you do progesterone source for 14 days, a gonadotropin. So that's these ovulation induction drugs I was talking about, plus some prostaglandin, or you can do a progesterone source for 14 days, gonadotropin, and do your buck effect. So you can do combinations of all these. When you're completely out of season, again, you always want to do some kind of progesterone source for 14 days. You're always going to want to do some sort of gonadotropin. And then usually a prostaglandin. Again, we'll talk about specific protocols that include all these. And then usually manipulation of lights and melatonin can be useful too, in conjunction. Okay, so getting a little bit more specific. So if we're talking about the transitional period, Protocols that I've kind of reached for are you can do the progesterone for most people like to do a minimum of 14 days, especially out of season. And then again, if you can get that PG 600, you can it's useful. Otherwise, if you can't get your hands on it, I think GnRH is a good alternative to it. So you're going to give that on the day of, or if you're doing GnRH, I would do it at least on the day of. I wouldn't do it before. I think the PG 600 to do before progesterone removal because of that long acting activity. But for the GnRH, I would wait at least until you pull that cedar to give your GnRH. If you're in late transition, again, you can use that buck effect, or you can plus or minus that progesterone that you did in early transition. And you, with the seasonal transition, you can do photoperiod manipulation to improve that. And so this is when you would begin with that long exposure during the summer. So you would begin over the summer making sure that they're getting that 16 hours a day. And it'll work better if you do it in confinement housing, because obviously over the summer you hit a point where the day length is going to start decreasing a little bit as you're getting towards the winter. So you'll have the best response if you can make sure that they're getting that full 16 days exposure of light. So during seasonal anestrus, again, progesterone, and again, most people like at least 14 days of exposure, and then PG 600. So this is the same protocol I talked about before. So day of or 24 to 48 hours. If you're going to use GnRH, I would just do it at the time of cedar removal. And then again, photoperiod manipulation works really well for this. If you're aiming to try to breed in the spring, so during the anestrus, you're going to want to start doing your long day exposure in late fall. And so this is when the days are going to be really short. So you're going to have confinement housing to expose them to that. All right. So moving on to some live cover considerations. So this should be planned around the desired date of parturition. And I guess for AI too, that's true also, is that you always start with when do I want them to give birth? And then you work backwards from there to determine when you want things synchronized. And you want to plan that the male is going to be left in for about 1.5 cycles. So this ends up being at about, so at minimum, so this is going to be about 30 days. So it gives him, at least one chance to breed. Some people like to do 2 or 3 cycles to give him a few extra chances to breed. It just depends on how many rounds of lambing and kidding you want to do. If we're talking about the male to female ratios, it's going to vary. And this is a nice chart from the Sheep, Goat, and Cervid Medicine book. So based on the, oh, I'm not ready for that yet. Based on the age, the scrotal circumference of the male, the size of your mating area, and whether the females are synchronized. And remembering that halter markers are really useful so that you can keep records of who was marked when to look for kidding and lambing. So here if you've got a 1-year-old that is in a paddock or confined pasture, you're going to have about 1 male per 20 to 25 females. With your adult males, if you're doing a paddock or confined pasture, you can do pretty high, 1 to 40 to 50 females, 1 male per 40 to 50 females. If you're in a range situation, it's going to obviously take that male a little bit longer to find the females in heat. So you really want to lower that a little bit. So 1 male per about 25 to 30 females. If they're synchronized, then it's going to be even lower because he has to find all of the females that are showing heat all at the same time. So you're going to push that down to 1 male per 15 to 20 females. And if you're doing synchronized females that are out of season, that's going to be about 1 male to 5 to 10 females. And again, if you're doing lights and you get that male in the lights, then you might be able to push that a little bit heavier because again, they'll experience some of those photoperiod effects also. Okay, so I have a poll question here.
Okay, there you go.
So in what breeding situation would using a double dose of prostaglandin be most beneficial for synchronizing our female small ruminants?
Deeper question. Okay, do you want to give some feedback, please?
Yeah, so wow, this one really tricked everybody. Okay, so remembering that yes, a double prostaglandin is most people got that it was most useful for live cover, so that's correct. But it's going to be most useful for live cover within the breeding season because the prostaglandin will not bring a female that's out of season into heat. So you have to use a synchronization protocol that includes a progesterone or a progestin, such as the cedar. So you have to have one of those involved if you're breeding a female out of season. So prostaglandin alone will not bring her into heat if she's not cycling. So it's going to be live cover that's within the breeding season is the most useful. Other than that, you're going to include a progesterone.
Okay.
Okay. All right. So moving on to talking about artificial insemination. So advantages of doing this over live cover is that it's going to allow you to choose some genetics and use some superior sires. For some people, it'll completely eliminate the need to have males on the farm because obviously they can be quite destructive, and smelly and intense. Semen costs nowadays are not super expensive, so it's not something that's really cost prohibitive on that aspect. And it'll decrease the risk for venereal diseases since most semen is going to be collected from a clean male and it's put in a preserver that has antibiotic in it. So your risk for venereal diseases are going to decrease. Disadvantages is even if you're going to be doing this yourself, you have to have a semen tank to be able to hold frozen if you're doing frozen semen. So you have to have that equipment. You need the cost for synchronizing the females, even if it's just giving prostaglandin, increased labor expenses. Again, this is going to depend on the type of AI you do. And in general, this is getting better, but compared to our bovine counterpoint or counterparts, is we have a lot less data on heritable production traits. But again, this is improving even from the first time that I was I was altering this today, and I was like, I'm going to still keep it on there because we still don't have quite as much data we have is in bovine, but it's getting better every year, especially with small ruminants. So for artificial insemination, it's going to be used mostly for breeding stock, producers, hobby farms, show animals. If you're using fresh semen, it can be deposited either in the vagina, or at the cervix. We call that kind of splash insemination. Or you can actually go into the cervix and do transcervical intrauterine or the intracervical. And this is something that a lot of owners can be trained to perform, especially in goats. Laparoscopic intrauterine insemination is going to be what's recommended most for your high quality frozen semen, and obviously will require advanced training. So you usually have to pay somebody to come out and do that. So frozen thawed semen is what I've found is most commonly used. So this is either in a quarter cc or half mil straws. And a lot of these, because they're collected using custom collection, we do typically recommend like taking a small drop after you thaw it and checking the motility just to make sure that it's not all dead. Um, and obviously the semen quality is really important. So if we do that laparoscopic AI, you need a really small amount of semen because we're completely bypassing that cervix and we're going to get 20 to 40 million progressively motile sperm that we're going to directly put into the uterus. If you're doing transcervical intrauterine, you need somewhere around 50 to 100 million. So you see that's almost doubled progressively motile sperm. And as I think we talked about this before, this is not recommended in sheep because of their cervical anatomy. If you're doing intracervical, so this is where you're putting it into the cervix, you can't get it all the way in, you need even a higher dose, so 180 million progressively motile sperm, which again, not recommended in sheep because it just doesn't work really well. And then if you're doing any type of that vaginal or splash insemination, it's not recommended to do that with any frozen semen. So you can do that in sheep or goats, but it's recommended to do that with fresh extended semen only if you're going to do that. So and again, these are some synchronization protocols that I like when you're trying to plan for AI. Most of them are going to involve, so this is one that where you give a prostaglandin and then you come back and you give a GnRH and then you give another prostaglandin and then you can do your timed AI with another dose of GnRH. This is a pretty common one of doing your cedar for either 11 days or 5 days. These are just kind of two combinations of protocols that I've seen before. And then you can give that PG 600 and the prostaglandin and then do your timed AI about 48 to 60 hours later. Again, it's going to depend on the person who's doing the AI, what they like to do. And then this is that other one that I showed that you're going to need your heat detection for where you're doing that double prostaglandin. And this is protocol. These are protocols I've been using recently, and I have actually really liked them. So, and a lot of times I'll sometimes add a cedar in these too. So where you give GnRH and then I put a cedar in. Oops, I'm sorry. I put a cedar in at GnRH and then 5 days later pull the cedar and give prostaglandin, and then you can give GnRH. And again, because that GnRH is shorter acting, that's why I kind of like it a little bit later and closer to the time that we're going to do our AI. So you'll see we do our 12 to 14 hour laparoscopic AI afterwards. Goats, it's not too different. Is we're doing GnRH and doing like a 7 day GnRH because again they're estrous cycle is just a little bit different. So, and then giving GnRH 2 days later, and then 16 hours afterwards doing transcervical AI. So, depending on if it's a sheep or goat, this is the protocol that I've been doing lately, and I've really liked it. Uses that GnRH. So this is just kind of showing like you can just do your transcervical AI standing with a little speculum in there. This is what you'll see with that external cervical os that you'll aim your AI gun in there and then you just kind of manipulate it from kind of the outside. You'll feel the crunching of it kind of going through the cervix. So laparoscopic AI, again, we're bypassing that cervix completely and going in with two laparoscopic ports. You'll see we have them fasted and we sedate them, so usually requires a veterinarian at least on site. And then you're basically just finding that uterus, and this little AI gun will have a needle on it, and you're just injecting the semen directly into that uterus. Okay, I've got one more poll question here.
Okay, let me go. There you go.
So this is what is the advantage of using laparoscopic AI versus transcervical in our small ruminants? And I'm just realizing I don't think I actually specifically said the correct answer, but it looks like most people knew what I was getting at.
Okay, can you give some feedback?
Yeah. So I don't think I directly said, but laparoscopic AI does yield better pregnancy rates when you're using the frozen thawed semen. And so most people got that, so that's great. And obviously it's not cheaper and easier to perform than transcervical. It's a little bit more difficult and it does require synchronization. So doing it off of heat detection doesn't usually work well just because you're usually paying for somebody to come. So you want to have them all synchronized and ready to go. And it can be performed out of season. So C was just not correct because of that. So you can perform it out of season. You might not have as good of success rates, but it can be done if they synchronize well. All right, so just the last few things I have here. I just want to emphasize the importance of heat detection for a lot of this stuff. Like even if you're doing laparoscopic AI, it's helpful to know that they've come into heat to make sure that um, that everything the synchronization protocol worked. So again, using a teaser male is the most effective way to do that, and putting a harness on him. So when you come to do the AI, that you know that they've been marked. And apologize for the pictures, but this is how we do this one's a vasectomy where we remove that ductus deferens in there from the testicles, or you might see your veterinarian might perform a complete epididectomy. And so both of these basically just remove the transit from the sperm to the into the ejaculate. So they will retain their sexual behavior, but they retain the risk of venereal disease transmission. So if you are planning to have your male turned into a teaser, I wouldn't recommend lending him out to all your friends. So because if he goes to another farm, he could pick up venereal diseases and bring it back to your farm. So I always recommend that if you're going to invest in this, is to keep that, you can keep that animal on your farm for quite some time. So we've got some at the sheep barn here that, they've had for several years that we've done. Actually, that's these guys that we've done for them. And so just kind of the finishing up here is making sure that at the end of this, we do pregnancy detection to determine if all this was successful. It also helps us to determine if there were any infertility issues, any health problems, if we want to make any culling decisions, and also to make sure that we're determining quantity, so singles versus twins versus triplets versus quadruplets. And we care about the quantity because it's going to affect our gestational nutrition management, which I talked about at the beginning. It's going to help us to manage things like their risk for pregnancy, toxemia, and also dystocia considerations. If we've got, 3 or 4 in there, then we definitely want to make sure we're watching them. Or if we have one in there, we want to watch and make sure that it's not going to be too big and that she's not going to need a C-section. And so the easiest way to do this is ultrasonography. I know a lot of producers are doing this themselves, but if not, you can always hire a veterinarian to come out and do it. It's the gold standard, but I also saw recently there is a blood test out there now that's a stall side one that if you're able to get blood from them, it's actually like a little snap test that you can get to test it at your house and so or your farm. So that's available now. Knowing that there are, if they had a recent pregnancy loss, false positives are possible. Whereas with ultrasonography, you can usually tell if they're viable or not. And then these are, you guys can kind of look at these on your own since we're running out of time here, but these are just different schematics you can look at. This one's for sheep and this one's for goats, just to try to see, making sure that you're checking your reproductive performance at the end of each breeding season, and are you where you want to be with how many animals are getting pregnant, how many animals are born per exposure, things like that. Are you where you need to be, or do you need to look into altering something? And these are all the different variables that you would consider if you are trying to figure out, gee, why is my kidding rate so low? Or why is my pregnancy rate so low? So this is just a bunch of different things that you can consider and talk with your herd veterinarian about. And then happy to take any questions.
Yeah, I think there are a lot of questions. So Jennifer, go ahead.
There are. I've been keeping track of them for you, though, Jamie, so you don't have to go scrolling back through the chat.
Okay, great.
If we go back to the body condition score, kind of at the beginning of your talk, what body condition score should dairy goats be before breeding? Kind of keeping in consideration that they're in milk until 60 days before kidding.
Mm-hmm. Yeah, I would still put them, a 3 would be good. Again, if you're not too concerned about, a lot of those are already kind of prolific and you're not concerned about having to do breeding. But I certainly wouldn't want to, I wouldn't want to, and I think getting them to a 3 if they're lactating is still going to be pushing them pretty good. So I think that would be the best kind of answer there.
And the next one's still about body condition score, that they have boers that have a body condition score around 3. They're 60 days bred, and they're curious if they can pull them off grain or if they need to keep them at that current level of feed.
I think you can correct. I never advocate for completely changing their diet, but you can, if you feel like you need to drop their condition a little bit, you can gradually decrease it a little bit. So especially 60 days, that's not, that won't hurt them too much if you want to gradually decrease a little bit. But then being mindful that, yeah, as they get into that 3rd trimester, you need to make sure that they're still getting enough that they're not going to be at risk for developing pregnancy toxemia, especially with boars. They tend to have they can tend to have multiples, like this one right here.
Right. Okay. So, and then along that same line, animals that are consistently at a body condition of 3 on pasture. What's your recommendation there? How do we get them lower if we're wanting to flush them? This was kind of during the flushing talks.
Those are always difficult ones, right? Because if they're out on pasture, so muzzles or bringing them into like a little bit of confinement situation where you can better control their intake. So if they're not on any grain at all to pull off, then it's usually trying to bring them in and pulling them off themselves, which
Right.
not always feasible for everybody.
Right.
But again,
Right.
if it's a breed that the fecundity is already good, then starting them off at a 3 is fine. It's the 4s we don't want to get to because 4s turn into 5s, and those are the big risks. So if they're starting at a 3, if you're not worried about whether they're going to have triplets and whatnot, so if it's a breed that you're not that concerned about, then I think that's fine to start them off there.
Right. And then moving into kind of the buck effect, does the buck effect or dormitory effect work for off-season breeding? And
Not.
along with that, would a buck rag induce LH production? Kind of two different questions, but same.
I think I think it works best in the transitional. Now, if you wanted to try to, and most of that's probably because that's when the male is going to start really being stinky. So if you've got a male that, is, it's smelling quite bucky, to put it, frankly, then it might work out a season, but you'll have to follow it up with hormonal anyway. So I think most people don't bother with it because it's not going to work on its own, just because they're still going to be out of season and they still need some hormonal stimulation. So I think it just doesn't work as well on its own for out of season. Whereas with the transitional, you're kind of just priming them to start and then letting the seasonal effect take over.
Now, if it's out of season, you have to work on the male to start the libido in the male, probably with light. So, because if the male is not like a active sexual, so will be not working either.
Mhm.
Yeah.
And then we had some questions about the cedars and using them in dwarf goats. Is there any concern with vaginal size in these smaller goats compared to their standard goats, or maybe a different in dosage or any of that kind of stuff?
No, so yes, but no. The younger ones, I've had issues with the cedars not fitting very well. But once they get to an adult size, even if like you see just like a tad bit hanging out the end, as long as they're not pulling them out of each other, and sometimes I've had to cut the tails off of them to stop them from doing that. Then as far as dosage goes, no, we're not really concerned with that. We still have had good luck with, or good success with them working. Where you worry more about the dose is if they're getting underdosed. Overdose is not as big of a concern, but when they're getting underdosed, and that's where like feeding that oral MGA becomes a concern, because if they're just getting enough that it's affecting things, but it's not really blocking their ovulation or their ovulatory effects, then that's where it can cause those cystic ovaries, because they're just getting a low level of it.
And then we had a couple of questions about the PG600. One is storage. Can it be stored in the freezer? And the other was, are you willing to share the proper dosage of the PG600?
Yeah, so the PG600, yes, I've done that before, where because it obviously comes as a powdered vial and you reconstitute it. So once we've reconstituted it, usually I wouldn't freeze the vial itself, but I would make little syringes of it and freeze those. Then you can just grab a syringe and thaw it when you need to use it. So I've done that before, with a lot of success. And then the dosage, it's usually like at a season, I think most people do like 1 to 2 mils. And when they're doing it or so within the season, and then for people doing it out of season, they might bump that up to like maybe like 3 mils. So
All right.
there's a lot of different dosages out there depending on like different protocols. So a lot of people just choose different things, but those are the ones that I've used.
All right. And then I think the last question, because we're now 5 minutes over. So there's a lot of questions about feed and kind of what is the best flushing feed, corn, rice, those kinds of things. Do we worry about protein? Do we worry about energy? What are we looking for when we're feeding for flushing?
Mostly energy. So versus protein. So we always think of protein kind of as an energy source, but we're looking for something that's going to produce the best energy. And I'm not a nutritionist, so I'm not going to go way far in depth of that, but there's a lot of good, I will say there's a lot of good extension articles out there that I found. So if you that have like some different dosaging. So but it's a good quality energy is what we're looking for.
Awesome. And I know we've probably missed a couple of questions, but I think a lot of those questions might be answered if we take a minute to come back and watch the video again when it's out on YouTube. So I think we've got the bulk of them.
Okay,
Okay.
great.
Okay, thank you. Now, Dr. Stewart, do you want to invite the people for the next Monday?
Do I want to invite them?
Yeah, sure.
Yes. Yes, we're going to talk about we're talking about males next week. So it'll be kind of again, another continuation of this one. We'll talk about managing the males for reproduction and how to prepare them for the season and make sure that everything works well.
Okay, well, thank you so much, and have a great week. We see you next Monday. Thank you, Jennifer, Dr. Acharya, Dr. Stewart. We are so grateful with you and with all your experience. You have a lot of knowledge. Yeah, thank you so
Thank
much.
you.
Yeah. Okay, everybody. And we are going to make a raw poll of the 5 books, and we are going to later on to say who were the winners. Okay. Okay. See you.
Bye all.